everyone, it's Casey here, and I have Miss Abigail, and we're going to watch a video today about the importance of blood work, why your veterinarian may want to run blood work, and what those tests mean.
That was a good one. That was a good one. Yes, it was.
Melissa, Dottie's lab work looks unbelievable. Looks
Good.
better than mine, especially for an 8-year-old dog.
Good.
So this first group of tests on this sheet, that's our complete blood count, or our CBC, and that looks for things like infection and anemia. And we'll go over that in a minute. The second sheet is going to have our organ profile. That's going to look at liver, kidneys, blood sugar, that sort of thing. So let's start with the complete blood count. So this first group of tests on the complete blood count are the red blood cells.
Okay.
If these were low, we would be anemic. You can see we're right in the normal range. In fact, the best test for anemia is called the hematocrit, this test right here, and it's 44.8, which is perfect. So that looks great. These are the white blood cells. White blood cells, we really don't want them low or high because they can be, you can have an infection, you could have what we call a stress leukogram. There's a lot of different things we look for, but to make a long story short, you're right down in the middle, which is perfect. It's right where you want to be. Platelets, these tests, these last group of tests are tests that are involved in blood clotting, so we don't want those low especially, because then you can have problems with blood clotting. These little dots are the way that the analyzer determines these counts, which is kind of cool. I won't bore you with that, but it's kind of neat.
Okay.
The second sheet is our chemistry profile. So this is going to be organ function, liver, kidney, blood sugar. So let's start with that. Glucose, or blood sugar, is right in the normal range. We're looking for diabetes, basically,
Okay.
because dogs do get diabetic. You're sitting great at 89. The other thing is we don't want low blood sugar because there's certain diseases we see in dogs where we can have low blood sugar as well.
Okay.
So you're at 89, that's perfect. The group of tests right here are our kidney profile. That's BUN and creatinine, phosphorus. You can see those are all in the normal range. I don't want those high.
Okay.
So that looks great. That's something we're going to want to watch every year, especially as we age. Calcium is an interesting test, and everybody thinks about bone growth and all that sort of thing. I am more concerned with calcium because certain cancers in the dog can cause high calcium. Not every type of cancer, but I definitely like to see calcium in the normal range. And you're at 10.4, and that's something I like to watch every year as well. It's a very important test in the dog. This is your protein profile, which looks good. You can see globulins are low. To be honest with you, the only time I'm going to really worry about globulins is if they're high. Because globulins are antibodies, and we can see them go high with certain infectious diseases. You can see normal's 2.5 to 4.5. You're at 2.4. I'm just not very excited about that. I'd be more interested if they were high.
Okay.
The other test on here that's really important is called albumin, this test right here, which can go low or high. It can go high with dehydration, and it can go low with certain things like liver disease, kidney disease, and other things. So that's a test that I'm looking at on every profile. That's a great albumin, so that looks great. Here's your liver profile. These first three tests are liver enzymes. I'm really looking for them to go high. I don't want them to go high, but if they go high, that can indicate certain problems with the liver.
Okay.
And you can see with Dottie, she's right in the normal range. In fact, she's low normal, which is wonderful. T-bill is bilirubin. That's a test that goes high if animals are icteric or jaundice, like they get yellow.
Okay.
That can indicate liver disease and also hemolytic disease where we have problems with the red blood cells, but totally normal. Cholesterol is 134, which mine was. We don't see the high cholesterol problems like they do in you and I, but it's something we do look at. Some dogs with thyroid problems, they can go high, but nonetheless, 134, you're right in the normal range. And then amylase and lipase, these are two pancreas tests that we look at in the dog, which are normal as well. We also have the electrolytes right here, sodium, potassium, and chloride, all right in the normal range. That's really important, especially potassium, because potassium can go low in certain older animals, but you can see she's sitting right in the normal range. I also did a urinalysis, which was normal, no sugar in the urine, no infection in the urinary tract, normal cells, everything looks great. So this is a great profile. This is something I want to do every year now that she's 8, and we'll use this as our pre-anesthetic test, so we can go ahead and do that dental tomorrow if you want.
Okay, that sounds great.
And why don't you just bring her back in the morning and we'll get it done.
Okay, sounds perfect.
Thanks for coming in and
Thank
doing
you.
such a great job and having a great dog.